Good morning, everyone. I'm Fabio Lima. I'm the Structural Heart Fellow at UCSF. I'm here with Dr. Michael Reardon, and we're at the CVIS conference in Tucson. Dr. Reardon, thanks for coming and doing this interview with me. I'm interested to get your perspective of what brought you to the CVIS conference and what you're looking forward to most here.
Well, Fabio, thanks for having me. I'm really looking forward to this conference. Tom Wagner's a good friend. I've had an opportunity to run a lot of clinical trials, and I've noticed fairly on that Tom is a great recruiter and does great work. And so, since I want to get him in more of my trials, I thought if I come out to his conference, we'll get to know each other even better, and I'll give me a chance to bring the team out here into some more of our clinical trials.
Oh, that's great. Well, tell me more about your perspective on some of the hot topics that are going on right now with younger and younger patients being offered TAVR, and there's obviously been recent discussions at the SDS meeting about the lower risk patients. Yeah. So I'd like to hear your thoughts of, because this is something we encounter a lot as more and more patients getting educated about TAVR options and having more minimally invasive approaches.
So Fabio, there's some really interesting data that's come out in low risk. So at the TCT this year, Marty Leon gave the 5-year PARTNER 3 data for low risk. I gave the 4-year Evolute data for low risk. And when I gave my talk, one of the things I started out with is that if you look at the growth of TAVR in the US, in 2023, based on TVT data, we did 98,504 commercial TAVRs. In 2022. In 2023, we will do over 100,000. Now, there's also growing data that the field is moving to younger and younger patients.
Yeah.
The Invasive database, which covers about 95% of the academic medical centers, did a study in northern New England, and they divided their patients into less than 65, 65 to 80, or over 80, which is what our guidelines say.
Yeah.
Our guidelines say less than 65, live 20 years surgery, 80, less than 10 years TAVR in between patient discussion. Well, the Visian database showed in their database by 2021 of the people that they cover getting isolated aortic valve replacement, 47.5% of them were under 65. So, I mean, and it's growing. Yeah. So there's a lot of worry about that. So what do we know about low risk and what do we know about surgery? Remember in the P3 trial, the mortality crossed at 3 years, which is the same thing we saw in P2. So there is some concern there. It's still not statistically different, but they cross. In the Evolute trial, it's still expanding out in favor of TAVR, but it's very early. It's only 4 years. Now, this has got my surgical colleagues very worried. So at the same time that TCT came out, 3 days before, a paper was published in the Annals that was 10 days between the time it was submitted and the time it came out online that linked the STS database with the National Death Index to look at the results for low-risk isolated aortic valve. So they took isolated aortic valves, they had over 500,000 of them, and then they matched them to the inclusion-exclusion criteria of the low-risk trials. And they got down to about 62,000 patients. Now, of those, they could not match 18,700, 30% of them to the national database. So they had no idea if they were alive. So they just put them off the side and ignored them. They took the remaining 42,000 and then looked at what the mortality was. And the mortality for this patient group, which was a mean age of 74, 63% male, at 8 years was 12.7%. Now, if you do a population survival curve, that's 20% better than the normal population.
That's fascinating.
But remember, they threw away 30% of their data.
Yeah.
The commentary to this was written by Pat O'Gara, good friend. He's a wise, non-interventional cardiologist, no dog in the fight. And what Pat did was point out Doug Johnson's paper from the Cleveland Clinic. Doug wrote a paper from the clinic looking at isolated aortic valves because he thinks the STS overestimates risk in places like his.